Today we are on Cuba, a tropical island in the Caribbean Sea, famous for its rum, cigars, and its revolution. Since the revolution of 1959, the Cuban healthcare system has drastically changed. Child mortality has dropped from more than 60 per thousand in 1959 to less than 5 per thousand in 2013. One of the measurements that made this drop possible was the introduction of the Hogar Materno. Hogar Materno is a place where women with risk pregnancies live so they can be monitored during their pregnancy. This is all to decrease mother and child mortality. We talked with a pediatrician and she told us her vision.
My name is Janet Bello. Well, Hogar Materno were created here in Cuba. Hogar Materno is a place where we can have pregnant women with problems during her pregnancy. For example, they can have risk factors like high blood pressure or maybe diabetes, or they don't have the proper weight that they really need during her pregnancy. Or maybe they have social conditions that are not good enough for her. So we send that kind of pregnant ladies to the Hogar Materno, and there they have nurses and doctors who look after them, and they daily make a physical exam. They can know how her blood pressure is. They can also check if they have any new problem, and they are really concerned about their diet. They have a proper diet there. They have really been very useful for pregnant women and for the child that they have.
During our visit in the Hogar Materno in Havana, we asked women what they think about it and how they experienced their stay.
Mi nombre es Arlene Gamboa, pues primer embarazo que tengo.
Lady García González, señorita.
Estoy aquí porque estoy bajo peso.
Porque tengo 3 fibromas y es grave. ¿Cómo me siento? Bien, lo que pasa es que nunca he estado tanto tiempo fuera de mi casa, ingresada. Me siento bien con mis compañeras y los trabajadores. Yo tejo, me pongo a tejer, sí, tejer. Y ver novelas en la televisión, la misma rutina todos los días. Mañana me toman la presión, me miden, desayuno, después merienda, almuerzo, bañarse, comida. Nos toman la presión antes de acostarnos, nos dan la merienda y otro día es lo mismo todos los días.
Hogar Materno has many advantages, but how do women get there, and do they always go when they are told so?
Once that the family doctor detected that she really needs to go to the Hogar Materno, we normally have some consultation with other specialties, like the internal medicine, with the gynecologist, with the psychologist, and in a team of doctors, that decision is made. Not only the family doctor is the one who decides that. He has the proposition, but we discuss the case with other doctors, and finally, we have our decision. If the patient needs to go or not to the Hogar Materno. But what happened is that when a family doctor detected that patient needs the Hogar Materno, he is always right. But sometimes we send patients to the Hogar Materno and they don't want to go. Even though they don't want to go, they have to, because our health system requires that they go, because otherwise she can die or the child cannot be born in a good condition. So in those cases, we require a team. We require a psychologist, a family doctor, we require a pediatrician, and some social workers, in order to explain to that lady the importance of being in that Hogar Materno for her, because it can be, it can have benefit, it can be good for her and for her child. And if if the person doesn't understand, sometimes we have to call the police. Once they are there, they feel well there. They realize that they really have the condition, the proper condition there, with nurses and doctors looking after her and after her baby. It's okay for them. They stay there until she's okay and there is no risk for her pregnancy. Some of them requires to be the whole pregnancy there, and some of them can stay only for a period of time, not the whole time of the pregnancy. When I was a family doctor, it was about 15 years ago. I had a patient, and she had a high blood pressure, and she didn't want to go. But I talked to her. I have to do it many times, and also the gynecologist helped me with that, and also the psychologist and the social worker, and we finally convinced that lady to go there, and she stood there during 3 months, and at the end she didn't have any problem. She was okay during the delivery, and the baby was born fine. So I had that experience.
El proceso fue que cuando fui a la consulta y me pesaron, no tenía el peso adecuado para la cantidad de semanas que tengo ahora. Y entonces fui con el ginecólogo y me mandaron entonces para acá.
Proceso del consultorio, a ver, yo estuve ingresada en un hospital en González Coro porque estaba con muchos dolores en casa, cuatro días, y mi mamá me llevó al hospital, y en el hospital me revisaron y vieron que tenía una infección provocada por los mismos fibromas, porque como no son sangrantes, me provocaron unos dolores perros que no podía caminar, y me tuvieron ahí ingresada y me pusieron un medicamento en vena, y de ahí me soltaron para mi casa, y en el consultorio me trajeron para acá. Y tengo que estar aquí hasta que me hagan que vaya a París ya. De aquí para el hospital.
Well, we have some disadvantages. One of them is that the pregnant woman is separated from her husband, from her family in general, and also sometimes it can cause some kind of depression in the pregnant woman, but she has the opportunity to see her family daily, her husband, and anyone who can go there and visit her. They have a period of time daily to receive visitors. So in that way, sometimes it's not good, because you know that her husband is at home and she's in the Hogar Materno, and she misses that part of buying the things for the baby, because she cannot go and buy what the baby needs. And I think that's the bad part of the Hogar Materno.
Desventaja que estoy aquí y no en mi casa. A ver, si estuviera en mi casa, lo tuviera que hacer en mi casa. Vaya, me tuviera que cocinar, y aquí no tengo que hacer nada. El alimento, que es pésimo, es malo, el alimento. Yo misma no como pollo, dan mucho pollo. Yo no como chícharo, dan muchos chícharos. Y cuando dan jamonada, cuando dan esas cosas, yo padezco de gastritis. Tengo que estar, llevo días, es huevo, muchos huevos. Y hoy mismo tuve que comer arroz y frijoles, porque mi hijo me va a salir ahorita amarillo de tanto huevo. Un poco problema el calor aquí.
That's the difference between Cuba and Netherlands. Because here we have another conditions, and that's why we have to create our own things, our own things in order to be better in this care of the child and the pregnant woman. I've been to England, and in England I could see that they don't have Hogar Maternos either. For Cubans, is very, very good to have Hogar Materno because that has reduced the number of children that can die during the first week of their birth. So that's very useful. Before that we have Hogar Materno, many women, pregnant women dies because sometimes they have eclampsia because they have high blood pressure and they were no place to go to be followed up properly. And I think that was a good idea. And since we have been having Hogar Materno, we have had many good results in terms of the care of the child and the pregnant woman. We are not a country from the first world. We have different conditions, and well, we really need to have a Hogar Materno for good. For good.
As one can see, the story of the Hogar Materno is one with many faces. On the one hand, you want to provide the best care possible for women and children, which has been shown to work when we look at the statistics from before the revolution and now. And when we take into account that Cuba is still a developing country where the average salary is $40 per month, and child mortality numbers are similar to those in developed countries. But on the other hand, you do not want to jeopardize the freedom of the pregnant women. The women do not have a say in if they want to go to a Hogar Materno or not. They are obligated. They are away from family and friends and are often bored. But when we look at the Cuban healthcare system, which focuses on prevention, Hogar Materno is one of the best examples to describe. In order to keep the population healthy, they have to give up some of their freedom.